The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, TMD warriors. Welcome. Thank you for joining us on this next episode of TMD Demystified. My name is Tony Urbanek. Today's topic and title is Smoke, Mirrors, AI, and TMD. Smoke, mirrors, AI, and TMD. As you probably know, artificial intelligence has taken over as a topic of discussion as the latest and greatest hope for mankind. Quite a bit of discussion about the concerns about it actually taking over mankind and doing disservices. I have an opinion on that also, but today's topic is we're just going to compare AI as it applies to TMD. So artificial intelligence are basically super duper computers that operate extremely fast and can compare and contrast vast numbers of data to give opinions and answers and solutions, so-called solutions to problems. There is no doubt that these new computers can work extremely fast, and that's their biggest advantage. They work so fast, much faster than the human mind can contemplate or work, and give answers which may or may not be correct, but can give answers to a very large number of questions extremely rapidly. But regarding TMD and the relationship of the potential of AI and TMD, I have a lot of questions and thoughts. First of all, the diagnosis and treatment of temporomandibular joint disease has basically been a consistent menage of smoke and mirrors applied to both the symptoms and the diagnosis and the attempts to treat symptoms of this problem. I've talked many times about the history going all the way back to 1934 and Dr. James Costin, who first identified and wrote the first paper in the medical literature identifying most of the symptoms associated with TMD, temporomandibular joint disorder singularly, not plural. It's not a plural of disorders. It is a single disorder, which basically is inflammation within the temporomandibular joint. We'll talk about that a little bit more in a moment. Dr. Costin, 1934, from St. Louis, an ENT surgeon, wrote about the symptoms of headache, earache, and jaw pain associated with the temporomandibular joint. And he stated his opinion was that the syndrome of these symptoms were related to lack of support or lack of teeth in the posterior jaws, which created the symptoms themselves. It's the lack of teeth. Now, that was his opinion. It turned out to be not true, but that was the beginning of the attempt to describe symptoms, describe the problem itself, and hopefully come up with a solution. His solution was repair the lack of posterior teeth, which would then alleviate the symptoms and alleviate the problem. Well, again, that proved to not be true. But over the next decades, from 1934, 44, 54, 64, back in the early 60s, late 60s, the oral surgeons began taking a look at these symptoms to see if there was something surgically that could be done. And one of my oral and maxillofacial surgery colleagues, Dr. Danny Laskin from the University of Illinois, wrote a seminal paper on the myofascial pain dysfunction syndrome theory, which in his syndrome theory, syndrome meaning he elicited the symptoms, which were very disparate symptoms, headache, earache, jaw pain, neck pain, shoulder pain, as we now know, also ringing in the ears, fullness in the ears, dizziness, upper back and shoulder pain, arm, hand, finger tingling and numbness, and various kinds of jaw locking. Those are the accepted, well-established, well-accepted symptoms of TMD. Dr. Laskin in 1969 in his seminal paper basically confused it with overuse of the muscles because of bruxism. Bruxism meaning is a technical word for excessive clenching and grinding. So excessive clenching and grinding basically wore the muscles to a frazzle, creating pain, creating the symptoms, these disparate symptoms of TMD. Well, he admitted in his seminal paper that it was just a theory, and actually that theory proved to be untrue. But as time moved forward, many individuals, dentists primarily, because physicians gave up on control of this temporomandibular joint because it was attached to the jaw, which was attached to teeth, and the physicians, the physician sciences had no interest in having anything to do with teeth. So it was given to the dental community, the dental profession, to try and solve. And at that point, the dentist applied what they knew about teeth to try to solve the problem. You can fix teeth, you can replace teeth, you can remove teeth, you can move teeth. And for the next several decades, that is what was applied to try to fix this problem that we call TMD, temporomandibular joint disorder. And then later in the past couple decades, through the 2000, 2010, 2020, various types of treatments applied to the symptoms, the first most common being Botox, paralyze a muscle because it hurts. You paralyze a muscle and it won't hurt. Well, that makes sense, but it doesn't, it only treats one particular local area. Or physical therapy, which makes sense if you have a muscle that is achy or painful and you use physical therapy techniques, massage, stretching. You can use dry needling into a muscle, which tends to relax the muscle. All those are physical therapy treatments, but they are, again, only temporarily, and they only treat the symptom. Of course, drugs have been available and used against this problem from the very beginning, and I'm well-versed on all of the types of drugs. After treating well over 5,000 people, both surgically and non-surgically, with this problem, and coming to me with a plethora of drugs being recommended, which are not effective. And along with those drugs come the multiple side effects, unintended consequences, side effects of those drugs. But all of these so-called treatments are geared and focused on treating a particular symptom in a particular area. And most, if not all, of the attempts to look this problem over have avoided looking at the actual cause of all these disparate symptoms. So what AI, getting back to the topic, AI, the only thing that AI has to work on is the data points, and there are millions and millions of data points regarding this problem we call TMD. The AI, because it can assimilate, collate, and translate all these data points very, very rapidly. All that the AI can do, though, is take previous data and massage it in one way or another, and then spit it back out as its so-called truth or recommendations. But it's only based on data that's already there. Although it's very quick in its response, it does not make it effective. So artificial intelligence is not the solution to TMD. To prove that point, I actually question ChatGPT as to what is the best solution for TMD. What is the best solution for TMD? The response I got was basically the same old stuff, the same old smoke and mirrors. And I can go through these now. I can go through these and read them off to you. They are what has been in the press, in the literature, in the scientific literature for decades. There's nothing new here, but here is the response. The personal actions that could be taken: avoiding jaw movements like wide yawning and chewing, applying heat or cold packs. Well, heat is much better than cold. Cold is only used in the most acute phases, basically within the first 24 hours of injury. After that, heat is most appropriate. Management of stress. The only thing we know about anxiety and stress and bruxism, clenching and grinding, is that they are related. We have no idea how that works within the brain stem, where it works, and how that mechanism works, converting anxiety, stress, and worry into bruxism, clenching and grinding. The only thing we know is it is related. The more anxiety, the more stress, the more people tend to clench and grind. And it is relative to the patient itself, and relative to the stressors, and relative to time. So there's no fixed concept about anxiety, worry, and stress and bruxism. It varies so much over the individual that you'll never be able to make a specific recommendation that applies to everyone. But certainly, if you can decrease stress, you can decrease bruxism, but not take it away completely. If you are a bruxer, you will always be a bruxer. And at times of stress and anxiety, of which we experience on this planet 100% of the time in 100% of the population, stress and anxiety is not fully controllable. Therefore, bruxism is not fully controllable. So that is one of those concepts that is really nothing more than smoke and mirrors. Medications themselves can be non-steroidals like ibuprofen and naproxen. They work really well for a short period of time, and they actually work on the source of the symptoms, the source of the symptoms being inflammation within the temporomandibular joint. That is the point I made. That is the research that I did that proved inflammation in the joint drives all the symptoms. So if you can use something to decrease inflammation that is predictable and consistent and effective, then you can control the symptoms directly. Chronic inflammation is the common denominator. However, non-steroidal anti-inflammatories only work for a short period of time. If they worked well over a long period of time, that is all you'd ever have to do, would be take non-steroidal anti-inflammatories, but they're short-acting. They run out of steam. Muscle relaxants can relax muscles. Along with that, you have to take the side effects from muscle relaxants. And they are systemic, so you not only have a side effect in one particular area, but you can have systemic side effects, emotional side effects, nervous side effects. And then also in this list of medications is low-dose antidepressants. And I've seen many more antidepressants than low-dose. I've seen hundreds of people that have been placed on various kinds of antidepressants for the treatment of TMD. Again, the systemic complications associated with antidepressants are noteworthy. Physical therapy, I think we've already talked about a little bit. AI continues on physical therapy, jaw exercises. Exercising the jaw is not effective at all. Ultrasound and other modalities, the latest being laser low light therapy, which certainly has an effect on inflammation, certainly does, but laser low light therapy and its effect on mitochondria and the mitochondrial effect on chronic inflammation is only temporary. So laser low light therapy is another one of those symptomatic reliefs that would have to be used constantly without stopping it over a long period of time to have any effectiveness at all. Dental interventions. I've already talked many times about how half the dentists make a night guard, not knowing why they make a night guard, except that that's what they were taught in dental school. They weren't taught why a night guard is effective, because it's not. A night guard does not have anything to do with stopping bruxism. Remember, a bruxer is always going to be a bruxer. Under times of stress, he or she is going to brux. And a night guard doesn't stop bruxing. A night guard guards the teeth, so when bruxing takes place, you can't damage your teeth. It is effective on doing that, but not effective at all on the treatment of the symptoms of TMD. But actually, half of the dentists in the United States of America, when faced with a patient with TMD, will prefer to make or prescribe a night guard, give it to the patient, and hope they don't come back. That is a fact. The other half of the dentists don't want anything to do with TMD because they know nothing works. So, along with dental treatments can also be corrective dental malalignments, orthodontics, which has a certain value, but only after the symptoms are at bay, are eliminated, and you're left with some kind of functional malocclusion. So this is just another example of misunderstanding, smoke and mirrors, as it's applied to the treatment of TMD. And AI, artificial intelligence, only has what is already in the literature, already in writing, already vocalized in podcasts like this. That's all they have to work with, and they are volume driven. So the answer that they come up with, AI come up with, will be the answer that is most often appropriate, most often seen in any one particular set of circumstances. So the fact that, as an example, night guards have been used by the hundreds of thousands, if probably millions, throughout the United States. AI takes a look at what is the best treatment for TMD, and night guards would be there at the top of the list. Why? Because it is seen most often over the longest period of time. AI cannot create answers. AI cannot arbitrarily connect dots based on creative facts, or most likely creative assumptions that can be proven with science. AI does not actually think. AI can only arrange. It can direct an answer in one particular area, but it is not a human creative mind. And that is why AI is not going to be the solution for problems. It's going to assist in coming up with answers that have already been created by humans, human creativity. And then lastly, the AI recommended invasive procedures, which would be injections with corticosteroids in the joints. Well, it's known that corticosteroids actually damage the inside of joints, whether it be a larger joint like a hip or a knee. Over a period of time, it may relieve symptoms temporarily, but over a long period of time, corticosteroids, besides its significant side effects, have been shown to actually damage the synovium, the lining, and the tissues in the bone and the cartilage of joints, and especially small joints like temporomandibular joint. As an oral maxillofacial surgeon, the last recommendation by AI was surgery, arthroscopy, joint replacement, of which I've done thousands. Literally, I performed over 2,000 temporomandibular joint surgeries in my career, and decided after the first 36 years that that was going nowhere, at which point I decided to do my own research to determine what is really going on with this problem. Why are my colleagues only trying to treat symptoms and no one is looking for the common denominator, the actual cause of all the symptoms? And that's what I discovered. The discovery was very simple. My patients led me to the discovery when I consistently heard from my patients in interviews. If I take my finger, a pencil eraser, my tongue, a piece of cloth, gently put it between my front teeth and bite down, it feels better. I made a device that did exactly that, nothing more, nothing less, that they could speak with, that would be comfortable with, that could be maintained over a lengthy period of time, and found that when used according to a proper protocol, 24/7 for 2 months, nighttime only, indefinitely, for the rest of the patient's life, that it allowed the inflammation within the temporomandibular joint to decrease to the point where all of the disparate symptoms were relieved. They went away over a period of time. Each of those symptoms does not go down simultaneously. Each of those symptoms has its own rate of decrease. Fortunately, headaches, earaches, neck pain decrease rather rapidly. Tinnitus, ringing in the ears, fullness in the ears, and dizziness are much slower to go down because they work through a separate mechanism. But the actual solution and the understanding of the relationship between chronic inflammation and exactly how chronic inflammation creates these disparate symptoms is well worked out in the work that I did. The mechanism is quite simple through the autonomic nervous system, giving signals to the muscles to get tight, pull on the bone. Where it pulls on the bone is where it stimulates the pain receptors, and that is where the pain is generated from, where the bone is stimulated by pulling, by the muscles pulling on them. So artificial intelligence has a value. I think we're going to see a lot more of it as it relates to temporomandibular joint disorder, TMD. It has little value, proven by the fact that I questioned the current state of artificial intelligence, asking what is the best way, and all it came up with was the same old stuff, the same old smoke and mirrors that I have known about, that has been applied ineffectively for the past 40 or 50 years. I thought this was a good topic because AI is in the news. Everybody's talking about AI and how it's going to change the world. I think there will be significant changes, but not as broad and significant as everyone thinks. It certainly isn't going to make human creativity ineffective. It doesn't replace human creativity. There's nothing that is going to replace human creativity by a computer. It's not just not going to happen. With that being said, I'll leave you there to think about that, to see whether you agree or disagree. If you disagree, you're certainly welcome to. If you'd like to criticize what I have to say, I'm available at tony@tmjservices.net. For those of you who'd like to join our network of doctors throughout the United States who use a simple device that unloads the temporomandibular joint adequately over a period of time to decrease inflammation within the temporomandibular joint, therefore decreasing all of the disparate symptoms, that can be viewed at Urbanek, www.urbaniktmj.com. I invite you to view that, look it over. If you'd like to join the network, be happy to have you as a member of our group. I look forward to the next time to speak with you. We'll pick another topic that hopefully will be impinging, meaningful, and actually help you to the point that TMD is demystified. I am Tony Urbanek.